Hi, everyone. I am Tyliah Kekele, and I have the honor to be able to interview Assistant Professor Claire Greene. You are the Assistant Professor in the Program of Forced Migration and Health, which lives inside of the Helper Department of Population and Family Health. And you are going to be the first interviewee for our series called Faculty in the Field. And this series is really just about highlighting our faculty that are doing work, whether they're locally or globally. And you'll hear more as Claire shares just about the work that you're doing and where you are. So I want to start off by saying thank you once again for joining. And then also with the first question, which is you just telling us a little bit more about your current research, what you're working on, and what inspired you to pursue this particular area of study within population and family health.
Awesome. Thank you. And thanks, Tyliah, for this opportunity. It's so nice to have this space and to connect with you while I'm here. I'm actually sitting in Bogota, Colombia right now, where a lot of my work is based. And so my research really focuses on how to promote mental health and psychosocial well-being for populations affected and displaced by humanitarian emergencies. And Colombia is actually host to one of the largest migrant and displaced communities globally, both internally displaced populations due to the decades of armed conflict that this country has experienced in the past, but also international migration from Venezuela, from other countries in the region, even people coming through Colombia from outside of Latin America and migrating often north up through Central America and towards the US. So it's a really interesting and fascinating place to study migration and mental health and well-being, and a lot of kind of changes that I've even observed during my time here. But specifically, the project I'm working on right now in Colombia is trying to figure out how to promote mental health and psychosocial well-being for migrants while they're in transit. So to like a lot of the political landscape and changes that are happening, a lot of migrants within this region kind of stay stuck in transit for long periods of time because they're not able to get to their destination, or there are several barriers they face along their migration route that kind of leave them in this really precarious position where they might not have access to public services, to health services, to protection services in the country where they are at that moment. And so in this project, we've been working with different humanitarian organizations, also with university partners, and going to shelters where migrants are staying for a few days at a time, and through different community-based and participatory approaches, really asking them to say, kind of, what are some of the challenges you face? How can we imagine a way to promote your access to things that make you feel better, that improve your mental health, that help kind of protect you and your family as you're migrating? So we're currently in this fun part of the process where we're doing a lot of that brainstorming and design together with migrants within these shelters throughout different parts of Colombia.
How would you say your research is being received by the local community?
Yeah, I think, especially for this population and like, at least in the context of Colombia, a lot of migrants can only stay in certain shelters for up to 3 days at a time. And so they're really constantly on the move. And so we've been mindful about trying not to have this research be too burdensome for them. So we've really tried to simplify as much as we can.
Right.
And we've designed these short, say, 1 to 2 hour workshops where we engage with migrants and give them kind of space to talk about mental health, to talk about some of the challenges they faced, et cetera. And I think what we hear a lot is like, wow, I haven't had the chance just to kind of pause and talk and express and hear from the people that I'm traveling with, that we're sharing these same challenges and same experiences. So I think it has been kind of building out that space to do that, but also being mindful of the limits and boundaries that we need to think about, given the complex demands that migrants are facing during these trajectories. And I think, like, a lot of this, I really began to kind of drink the Kool-Aid of community participation a few years ago when I was first working in Latin America, in Ecuador, actually, through kind of a community-based psychosocial intervention where we also due to the fact that we didn't know what the needs and preferences of migrants were, we co-designed an intervention with the community, and they were the ones who developed it, built it, implemented it, et cetera. And I think for me, it's been really powerful to see that even after our projects have ended, when there is that level of ownership and involvement of the community throughout the entire process, it kind of stays in the community. We've seen that these interventions and these strategies have continued to be applied by these community members in different populations or in different settings, and it's kind of organically grown and sustained within these communities. So I hope that's an indication that it's being well received, but this project is currently in a stage where we'll kind of have to see how that all plays out as well.
What kind of challenges have you encountered while conducting research in Colombia? And how have you addressed these challenges to overcome?
Yeah, it's a good question. I mean, I think like a lot of the challenges stem from kind of broader structural and social dynamics and changes. Like for example, there was one shelter that we were working in a city called Ipiales, which is on the border with Ecuador, and we had developed kind of agreements with the shelter, had been working there really productively. But due to changes in funding, due to kind of social pressures within these communities who didn't necessarily want a migrant shelter in their community, they actually had to shut down and relocate because of all of these external factors. And so that's just one example, but often with like changes in policies and changes in really kind of like the social perception and stigmatization of migrants and migration, we really have to stay nimble and flexible with the approaches we're taking. And for me, I think especially as someone who is not Colombian, who loves to spend time here and get to know the culture, but I'm still learning so much, it really requires kind of reliance on partners and communities in order to navigate that uncertainty and those challenges. Yeah, so oftentimes those challenges are quite big, but we just have to figure out how to navigate them kind of hand in hand with the people we're working with.
How would you say you manage being full-time faculty and doing research that's not even in the country? How do you navigate both worlds and allow them to come together?
Yeah, I mean, it is a really good question. And I think with this project, I'm fortunate to have kind of a lot of time that I can dedicate to it, which is really helpful because I think the time spent here with the people I'm working with and also building new relationships and getting to know the context is really invaluable. Like I am so grateful to have the ability to do that. I've also been, I think, really fortunate to have partnerships here with different NGOs where some of the students I work with at Columbia have been able to come and spend time and do internships here. And so I think really trying to build out how I picture myself as a professor, as a mentor, to doing more than just the classroom-based instruction, but like working with students and working with partners in the field kind of makes that more flexible and broadens that perspective a bit. And to be honest, that's my favorite part of working with students is like engaging in projects with them in country, with our partners, et cetera.
Yeah, that's awesome. Thank you, Claire. My last question for you is, what future direction or like next steps do you envision for your current research, and how do you plan to further engage the community that you're working with?
Yeah, it's a really good question. And I think even the way we define community is important because in a lot of projects that I've worked on in the past, like community is defined by kind of geography, right? Like if you're working in a certain setting, the people in that setting become that community. Whereas when we think about migrants in transit who are mobile, how do we even define community when like who is existing in a certain place is changing all the time? And so I think as far as next steps and how I think about engaging community, I think a lot of what we find in this initial work, we really need to think about how do we promote its adoption and uptake within kind of the broader regional set of actors who are working to support the needs of migrants who are in transit in the region. And so currently, like I said earlier, we're just in the stage of designing a strategy and working with communities to figure out what they want. The
Right.
next step is figuring out, does that actually work? Does that help? And then how do we, if it does help, how do we make sure that different NGOs, different UN agencies are actually using this information to improve access to mental health in this case? And I think part of that too is building out the project so that we're not focused so much on geography, but on kind of the population, the community as a whole. And so I have a few other projects, for example, in Mexico. So along one of the main migration routes that a lot of these people are moving along, that's also looking at mental health among migrants in transit, but in a very different geography. And I think there's a lot we can learn by kind of putting these pieces together and thinking about community as something much bigger than like the people who are residing within a certain place at one time.
So the work that you're doing in different countries in South America, how would you say it contributes to the overall mission of POPFAM and just also inspire the students that are here currently and thinking about coming here?
Oh, that's a good question. I mean, I think almost maybe starting with the reverse, I think the thing that's really nice is like the values and priorities within PopFam, which really emphasize kind of this social justice and like doing the work that we're researching piece is what allows me to do the work that I'm doing. Like I've always struggled with being too academic or moving more into practice. And I think being able to do this type of work it does take a lot longer to do. It
Yeah.
is about investing in relationships and being very careful about the steps you're taking couldn't happen in many departments. And so I think the fact that PopFam really values the kind of service elements and the practice elements of this work make it possible to do that. And I hope there's some reciprocal value gained in the department because of this type of work that I and my colleagues in the department are doing.
Awesome. Thank you so much. That was incredible. I really appreciate your time, and I'm also looking forward to new updates from you when you come
Really
back.